Welcome to the Psychology Talk podcast. We are your hosts, Dr. Scott Hoye, clinical psychologist,
and Kyle Miller, licensed counselor. Psychology Talk is a unique conversation about psychology around the globe. We speak with psychology experts to keep you informed about current issues and trends. We advocate toward reducing stigma and educate about mental health.
While you're listening, please take a moment to give us a review and subscribe on Apple Podcasts, Spreaker, or your favorite streaming service. It helps us to continue providing you with quality programming. And now, enjoy the episode. Today, my guest is Jeremy Zug. He's a partner in Practice Solutions, which is a large billing firm that works primarily with mental health companies, either individual practices, group practices, or the like. Today, he's going to be talking about the state of mental health in general from his perspective, and we thought it would be great to have him on, specifically because he has kind of a meta perspective of the trends that are going on, and really this episode is more geared towards practitioners who will probably have a stake in these trends, and in general for consumers, if you're listening in as a consumer, to see how these trends will affect your ability to obtain mental health services. And Jeremy has a 14-year, is that correct? Jeremy, you have a 14-year experience working in the mental health field, primarily as a biller, correct?
Yeah. That's right.
And you started out, I think you started out here in Chicago in the very building that I'm sitting in where my office is at, a couple floors down, which is kind of cool.
That's right.
Kind of serendipitous. It's kind of a cool Chicago connection here for those of you in the Chicago audience listening in. Well, Jeremy, welcome to the show. Is there anything else you'd like to say to introduce yourself?
No, I think you nailed it. God, okay. Thanks for having me on.
Okay, you're very welcome. Thanks for taking the time out. So I know we outlined ahead of time some of the things you'd like to talk about today, and I'll let you just kind of introduce those things. And if you'd like to, you can explain a little bit more about your path before you do so into the mental health world.
Sure. Yeah. So my journey in the mental health world started at age 14 when I got a job at a community mental health center in Kalispell, Montana. And I was making paper charts for the staff clinicians there, if you can imagine that. So they didn't have an EHR back then, so we were taping together the red charts that had all that stuff. And my role there morphed at age 18 to working at a residential group home with actual clients. So I worked the night shift from 12 a.m. to 8 a.m. at the residential group home, and that was an exciting time to get to work with actual clients. And then, like you said, went to Chicago for school and then worked in your building, Suite 734. So that was very cool. That's where I got introduced to the private practice side versus the community mental health side. And that was a big shift. And then after graduating college, started Practice Solutions for some of my colleagues in community mental health who wanted a biller. So that was sort of our journey. We've been doing this for almost 4 years now. So it's been a good time, and really enjoyed learning just a ton about mental health and private practice and how intricate the insurance world is in this country.
Yeah, it's rather detailed, that's for sure. And just as a shout out to my home state of Michigan and my former school of Eastern Michigan, my undergrad days. Yeah. You guys are set up shop in Ypsilanti, Michigan. So that's kind of cool. So shout out to
right down the road from the school.
Yeah,
that's
excellent.
Right.
Good. Yeah. Well, and people can actually find you online, and you work nationally with organizations and individuals, which is great. So, well, what are some of the trends that you wanted to talk about today? What do you see as being some of the major things that are affecting mental health, both for the consumer and the practitioner?
Yeah, it's a great question, Scott. And I think that I'd like to start with one of the questions I've been asked recently by our clients and our team and other private practice consultants like yourself is what does telehealth look like in a post-COVID world, right? Is this a permanent fixture? And if it is, what are insurance companies and major health systems going to do about it? So I'd like to start just by talking about some of the data from some of the large consulting firms like McKinsey and Accenture, and even Beacon Healthcare has collected some of the data they have and published it. So I'd like to start with that. Then I'd like to talk about some of the macro trends that we're seeing insurance companies and major health systems do to compensate for a post-COVID reality, and then talk about some of the macro hiring trends that we're seeing in clinicians. So
cool.
That's sort of a general outline of what we'd like to talk about. It is a lot, yeah, but I think it'll be helpful.
Very much. Well, go ahead.
All right, cool. So what I wanted to start with is looking at some of the data that large consulting firms and payers have collected since COVID has become or forced most people into a telehealth world. And I don't know, are you doing telehealth too, Scott? Is that something you've
primarily with the lowered numbers in the summer? I was seeing a few people for things like biofeedback or as adjunct to therapy or hypnosis in the office. But since the numbers have gone back up, I've had to kind of put the kibosh on that and just do teletherapy at this point.
Yeah, and I don't think you're in the minority there. So according to McKinsey, and McKinsey's a large consulting firm, if you're listening and you don't know what McKinsey is, I think they're based out of New York. But they did a survey in April of this year, and the use of telehealth has gone from 11% for U.S. consumers in 2019 to 46% of consumers now using telehealth to replace canceled healthcare visits. So that's at large. We went from 11% to almost half of people in the United States using telehealth platforms. Amazing. Now, that wasn't compelling enough. I have two other stats for you. Beacon Healthcare, they looked at all of their claims data from April of 2019 to April of 2020. So sort of the height of lockdown and pandemic stuff. And telehealth sessions for mental health specifically increased 5,130% in April of 2020. And that's only on the claims where providers used telehealth modifiers in place of service codes that indicated telehealth. So it's suspected that number is actually higher because people didn't bill claims correctly or like they should, because the education on this stuff was pretty minimal at that point. But a 5,000% increase in telehealth is substantial. And Beacon is a large large payer for mental health insurance. But think about all the other payers like Aetna and Blue Cross and Cigna and Medicare and Medicaid and all the other payers in the country that probably saw a similar increase, if not more. So that's tremendous. But one of the things that I look at is, where does the money go, right? If you follow the money, you can kind of project what the trends will be in the future. So according to McKinsey, this is another McKinsey article that they published, I think last month in September, was pre-COVID, total annual revenues for U.S. telehealth companies was $3 billion, which is a lot, right? I mean, if a truck showed up to your office, Scott, with $3 billion in bills, it would probably fill up the whole thing, is my guess, right? Or maybe the entire floor.
Right.
Right. In 2020, in April of 2020, with provider adoption and consumer switching, that number is now $250 billion in current U.S. healthcare spend toward virtualized services. So that's not a number you can ignore, right? So that's a $3 billion to a $250 billion increase in the space of 12 months. So health insurance companies are noticing that. So when people ask me, is telehealth going to be around for the long term? My answer is yes, because that's where the money has gone, right, this year. I mean, that is just a tremendous amount of money, which has led to really positive things. And maybe, Scott, you can speak to this because I've been talking for a while. But have you been able to see more people get like healthcare services or mental health care services through the virtualized shift?
I haven't seen, in my own practice, I really haven't seen any drop off in the amount of cases I'm seeing. I do put a limit on that because since I'm in, I think 25 is the limit you can do and have a life out of an office, especially depending on the cases you're seeing. But generally speaking, I haven't had any decrease in my revenue since COVID hit. And if sometimes I have to turn off my ad revenue just so I can settle down and not take calls because a lot of people are calling right now, and it is problematic. COVID is problematic on a number of levels, but a lot of people's anxiety, plus the election anxiety this year, is pretty high on from all corners. So it's been. I haven't seen any change in it. The other positive thing is that I am less likely to get a cancellation. That's one of the positive things I think I and my colleagues have been noting, because people aren't moving around. They can easily extricate themselves from their job or find a spot in the house or the office to call in, and it's more convenient in that way. In a negative way, I can't really interact with the person as highly as I'd like to. I mean, therapists, and even if you're doing testing, you're taking a lot of data in from a lot of information in from people's subtle behavioral cues. So like right now, even though we have a Skype video here, I can't see what your hands are doing. I have no idea.
Right.
But like oftentimes in the office, if somebody fidgets and their fingers are moving, I might point that out and just kind of check in and what's going on? Are you feeling a little nervous talking about this subject? Or it's a little different. You have less, your sensorium is less, is diminished a bit, your sense information. So that I don't like, but at the same time, and I really do like seeing my patients. I like to see my patients in the office. So I regret the fact that I can't see them and be more there as a physical connection, which many people are grieving the loss of right now on such a level. But overall, I think that telehealth has increased availability of services and the convenience of services as well. So those kind of balance each other out in some respect.
Yeah, and I think I'm hearing the same criticism as well as positive viewpoint that you just shared, for sure. And I think, no doubt, people have more access to mental health care now than they've ever had before, just because of that shift. I mean, you have almost half of the country using telehealth services. A lot of revenue is going to telehealth, and I don't think that's going to change anything. I mean, I don't think telehealth companies or insurance companies are going to give up the $250 billion pot of gold that is sitting there at the moment. That really begs the question. I just don't think they're going to do that. That's not really how our system works. So there are really 4 macro trends that insurance companies are starting to lean on. And I like I said, I don't think the money's going away. I think telehealth is here to stay, even though some payers are saying end of December, this is like our valve for carte blanche telehealth is getting shut off, which is true. I think long-term telehealth policies are probably here to stay. So the four macro trends that providers really need to get ahead of are these. So the first is insurance companies are starting to define more value-backed roadmaps for treatment, meaning that they're leaning on data-driven approaches and empirical outcomes for priority populations, and they're going to start to develop strategies to digitally enable care in a way that providers can prove their efficacy. So that's a lot of big words, right? So basically, providers are going to need to be able to prove their value to the populations that they're seeing. So there's a couple ways to do that. One resource that has really become popular in the last 6 months is actually right down the road from you, Scott. I think they're on Whacker, but Blueprint Health is a digitally enabled measurement-based healthcare tech company based out of Chicago, where clients can engage in CBT and DBT interventions and worksheets. And then they can also track their progress through brief assessments, right? Like the PHQ or the GAD, right? Any of those brief assessments to track their progress. And I think companies like that are going to become much more popular because you can start to prove your outcomes. That leaves some theoretical orientations of counseling. That kind of leaves those behind, right? Like there are some theoretical orientations that don't necessarily follow empirically based outcome related treatments, and that will be a problem. So
yeah, well, it isn't. I mean, I would say that most people are integrative in the way they approach things. I don't think anybody is like one particular way of doing therapy these days. I mean, maybe some people are, but I think that the trend is even in variations, like say of psychodynamic models of treatment. There's scaling has become part of that, a Likert scale, like 0 to 10, how much anxiety you're feeling now versus post session. What are your outcomes? People are looking for that. And even though I'm integrative and I do kind of weigh in heavily on the psychodynamic stuff, sometimes my training has been, let's make sure that we can note this for the insurance company in case they'd like to see what value they're getting from the therapy, besides the patient liking you, and feeling a little bit better after the session. So I don't think that's a bad thing to ask for.
Yes. I think it's a good thing.
Yeah.
Yeah, for sure. The second thing is the second macro trend that I'm seeing from insurance companies is they're starting to lean really heavily on that value-based modality for credentialing even. They're starting to ask questions.
What's the difference between data-driven and value-based? Is the value predicated by the data that you can show? Like, look, my patient said that they have less anxiety, less depression. They're leading happier, more fulfilling lives based on these measurement tools.
That's correct.
Okay.
Yep.
Okay.
Yep. So being able to prove that your client's outcomes are on par for the norms in the field or ahead of the norms, right? Which how they define those is a little bit ambiguous, but being able to show value in terms of your clients have symptom reduction or symptom remission by seeing you is really what they're looking for. And in terms of, well, does that answer that question for you?
Yeah, no, absolutely.
Yeah. Perfect. On the credentialing side, they're going to start to accelerate value-based contracting. So they're going to start to ask, or they are starting to ask about how are you proving your outcomes, even at the front end. So before they credential you as a provider, they're going to start to ask questions about telehealth and outcome-based services. And they're also likely to align incentives for using telehealth, meaning they will probably promote you on their website with more attention if you're a telehealth provider that can prove your outcomes. Okay. So again, that's also a very important element if you're looking to take insurance.
Just to quickly run, what was the name of the place that is like, a couple blocks away from me on Wacker again? What's the name of that company?
Yeah. Blueprint Health.
Blueprints?
Okay. Blueprint. Yeah. Danny Fried is their CEO and he's just right down the road.
And it might be interesting maybe to have him on the show or something at some point.
For sure.
But like specifically, are they telehealth oriented or are they okay? And it's basically they have a number of these interactive pages or web designed, like taking a template like for the GAD or the Beck Depression Inventory or something, or Hopelessness Scale. And those are available within a telehealth platform. So like, for instance, those of you out there who see me or others, is it similar to DoxyMe, except it has this added interface?
They don't have a place where you can see patients or clients. But it's like an app on the client's phone that you can take these assessments or different interventions. Okay. And then there's a clinician login where you can track their progress.
Oh, okay. I like that.
And that's a really
I like that.
Yeah.
It seems very convenient. There's two things I have to say here, though, kind of as a tangent related to this. Many patients don't like to do homework, and they don't have time for it. So even if they have an app, many patients or clients are going to probably resist that. So, like, how do you how will that account for attrition rate if these type of interactions between you and the patient, or if you call them clients, comes up? how much of that will like, how much of that, I mean, it's measurable, like, and is it weekly? Do they track this like on a daily basis? Is it monthly? Cause that kind of intrusion in people's lives, people like the therapists, but you know, they like their privacy as well. So that's the only question I would have for that. Many people do not like homework. So.
I would definitely. Yeah, totally. And that would be something I would ask Danny. I mean, I know he's available for questions. It's just the idea that more tech companies are starting to look at mental health care as a place where innovation needs to take place, right? And I think that they're on the cutting edge of that, right? And I totally agree with you. I mean, I think that we see that with clinicians we talk to all the time, where clients don't do homework or whatever, and it's very hard to measure outcomes because of that. But yeah, it's just a unique innovation that has never been there before.
Right.
That we're starting to see with the COVID trending, right?
Yeah.
So it's very unique in terms of where money is being spent on innovation.
Okay. Okay. So that seems to be an upcoming trend. What's another trend, Jeremy?
Yeah, another trend is that insurance companies are starting to integrate virtual health into their care delivery, meaning like Blue Cross Blue Shield in some states has created their own telehealth portal like DoxyMe on their websites, and they're requiring sessions to be done through that platform in order to bill for them. Mm-hmm. And that'll be an important trend.
Well, it's hard. It's hard to actually enlist on that. So there's a limited number of practitioners who can get on that, and many of us aren't. And I think one of the things that's happening now, is you'll probably concur, is they're allowing for things like DoxyMe or, Simple Practices, Telehealth portal to be able to build for, right? And this might go the way of the dodo come December 31st, right? In 2021, they're saying, nope, no more.
Right. Well, and we'll see exactly what that looks like.
Yeah.
And so I think if you're a network with an insurance company that uses one of those, it's very important to know what their policies are around that. And if you are new to insurance, that'll be a question that you've never had to ask before, that you now have to say, hey, is there a portal specific to you, insurance company X or Y, that I really need to use and be a part of? Right. That's never been something that you've needed to ask before, and now it is.
I would assume that that will have to be something. I'm sure on the backside, knowing some people who work for Blue Cross Blue Shield, I'm sure on the backside they're probably spending a lot of money building up that infrastructure so that there aren't a lot of very angry clients and who are exposed to COVID by going to a doctor's office, and so I'm sure that will be increased. I'm sure, but okay, so
I'm positive. Yeah. I'm positive that's the case. And I know that Blue Cross Blue Shield has been a payer that for many, many years, their narrative has been, we want to increase access to mental health care, not take it away. So I know that insurance companies for a long time have this really bad reputation of, being stingy and that kind of thing. But I think Blue Cross is one of those that really earnestly wants to make sure people have access to mental health care. And how they do that matters.
You don't have to sell me on that. At this point in time, I don't mind Blue Cross at all. Yeah, I like them.
Yeah, well, and they're right down the road from you, right? Right there on Randolph.
This is where it's all happening, man. I tell you, right here, right here in Chicago. We're not a ghost town by any means. Yeah, it is. They're literally up like just on Randolph, just down the street. Yeah, exactly.
It's awesome.
Yeah.
They got that nice fancy building. So Well, and lastly on the trend side, payers are likely to reinforce the technology and analytics foundation. So they're going to build on that infrastructure that you talked about. And I think they want to see and realize the full potential of virtual healthcare in the country. And it's sort of like schooling from home. I don't think snow days are going to be a thing anymore, right? Because students can now do school from home on snow days. So I don't know if that's ever going to come back, where you don't go to school and you get a day off. But insurance companies don't want to realize that same value.
I think you're right. Yeah. I mean, but like if something takes out your power,
right. What are you going to do?
Yeah.
Right.
So I'm trying to think ahead for the kids who want to have snow days. So.
Yeah,
those are important.
Oops, my power went out.
Yeah,
can't join you. Yeah.
So infrastructure is going to change. What else is on the docket?
Yeah, I think that's on the payer side. So those four things will really shape the way that telehealth is adopted in our country. And then there's large health systems, right? So, Kaiser in California.
Yeah.
Is it Ross right down the road from you? The big major health system down there, or DuPage Medical Group.
DuPage, right? Yeah, Northwestern, right. I think is one, or
Northwestern.
Yeah.
Yeah. So a lot of those HMOs are starting to do a couple of things. One, they're starting to segment client populations for disease and specialty. So they're getting really good at saying, all right, what is your diagnosis, client, and who in our network of people can help you the best, right? Because they can see the claims data. They can see what you're diagnosed with, and they can also see on the credentialing side, especially with value-based contracting, they can see who's really good at symptom reduction or symptom remission for a variety of diseases and specialties. So what major health systems are starting to lean toward is pairing clients up with clinicians that have the best possible outcome through a lot of data analysis and technology. So whether you think that's a good thing or a bad thing, that's sort of the macro trend that we're starting to see.
Well, yeah, I think that people should get what they're paying for. I mean, you did mention those kind of ambivalent positive aspects that are not really tangible, right? They're not tangible by a scale, perhaps, right? So there's other.
Right.
So, like, the question is, how will psychiatrists and psychologists, mental health workers, social workers, how will they respond in kind by saying, "You're leaving this out. How do we measure for this? Is it measurable?" Because it's easy to scale something or ask us. Ask a person to fill out a list of items on a hopelessness scale or something like that.
Right.
But what does it really measure? So quality of life, there might be something more that's missing from that. But that'll be a back and forth forever, I think.
Oh, for sure.
Yeah.
For sure.
Yeah, so
this is not going to be a done deal in the next year.
No.
No.
So,
but it's I don't think they will codify.
Yeah, I mean, and I would welcome to have more of a more value-based judgment, like a more ambivalent kind of way, looking at those things that we call ambivalent, that maybe we can measure them better for outcomes.
For sure.
So, what are some of these other trends? Are there any trends on our side as clinicians?
And I'm glad you asked, because I think there's one big change that we're seeing. And we talked a little bit about this before we started recording, but I'm starting to see hiring change in the private practice world.
Okay.
So, and I gave the analogy of a friend of mine that is a limited license clinician in Michigan, and she just got rejected by 4 of 5 practices she applied to because she's a limited license person for a couple of reasons. One, the telehealth rules are really altering how you bill and how you submit claims. So those people, at least in Michigan, are of lower value because of the telehealth regulations. So they can't yield as much revenue. But the flip side of that coin is graduate student interns, or people that don't have a license yet, pre-licensed individuals are actually in demand because you can do a lower per diem cost for clients for those people's services. So we're seeing a really small window of people that are less likely to get hired. And some people that are perhaps less qualified than those limited license people are now in more demand. So that's just something that we've seen not only in Michigan, but also abroad, because the regulations around billing and revenue are impacting who gets hired and who doesn't. And that's perhaps one of the negatives of this COVID trend is, yes, you want more value-based stuff and you want to be able to track with data. But one of the problems with AI, and there's a partner at Accenture that him and I had a conversation about this. We're good friends, and he said that one of the problems with AI technology that determines a lot of this stuff is you don't actually know how it gets to the conclusion that it gets to. right? You can feed it data and the conclusion comes out with historical data. And that could potentially be a negative in terms of who gets to see clients, who's incentivized, and how people get hired. So that's something to just keep in mind if you own a private practice, to know, there are drawbacks to the benefits of the technological innovation here, for sure.
Right. Well, do you think that telehealth is going to subsume in-person mental health services? Do you think that teleservices? No? No?
I don't think so. I think, like what you just said, there's a lot of value to meeting in person. And I think clients feel that too. And I think that telehealth will be an accentuating part of mental health care. Like, I don't think it's going away, but I also don't think in-person sessions are going away anytime soon.
So it's more like it'll be more adjunctive to things.
I agree. Yeah, I think that's exactly what it'll look like in the future.
Yeah,
for sure.
It's interesting too, because the telehealth sessions that I've had, oftentimes I've had to convince people not to call me from their car while they're driving, and to focus on the session, focus a little bit more on it's a little bit difficult to get people to focus on their emotions while they're, in the process of driving or cooking or something.
Or maybe they'll just be really angry while they're driving, especially in Chicago.
Oh, yeah. You don't, even with the downsize in traffic, you still don't want to do that here. Are there any other trends that are going on these days?
I think that really encompasses everything that I'm seeing from April to November. We're almost in November, which is kind of wild, but I think that really encapsulates a lot of what I'm seeing.
Well, how this trend, I mean, it's kind of hard for you to track. Like, I believe that your insurance company primarily takes care of the billing through insurance billing. So if you have a lot of hirees showing up, like, 20 postdocs who say for a large, I don't think you'd want to try and supervise 20 postdocs unless you had a very large company.
Right.
But if you had, like, say they're hiring en masse, like postdocs and pre-licensure counselors or social workers, and they're charging per diem, I'm assuming they're probably not making as much for their kitty afterwards. And also, this must be affecting billers, right? As opposed to, it must be affecting, so not just you, but all the billers out there who help out practitioners get things done. I mean,
that's so true. I mean, we've seen one of two things. So these graduate student interns come in and they're able to provide services, and a lot of times good quality services for much cheaper, which is a good thing. But we're also seeing fully licensed people like you are just packed. Like, you've got no space, right? There's just no open availability almost anywhere, and it's very challenging.
Yeah,
right? Because you have
but by the same token, if you do have a wait list, or you see that there's potential to build up a practice, how are people doing that? I mean, you can hire somebody per diem at a sliding scale, but that's like and do you want to, in the middle of the pandemic with, a dicey stock market and dicey economy and dicey political system, do you want to hire anybody? Because having more overhead's probably not a good idea at this time.
Well, and some people are viewing that as an investment, because they can maintain that person as a clinician for a long time, right? And then see them become licensed and then eventually bill. So if you've got the cash to wait that out, that's a good idea. But a lot of people are not sure what to do, right? There's a lot of uncertainty. And I think waiting is actually an appropriate action plan given the current situation that we're in. Yeah. Because there's a lot of unknowns, right? And waiting is an actual action you can take, right? There's doing, and then you can not do, and then you can wait. Right. And I think waiting makes sense.
Yeah, probably the best, because even with the moving part, let's say you hired me as a pre-licensed, because for those out there who don't know, for counselors, you have to sit for 2 exams. And like, say, for instance, I'm a master's practitioner. I'm going to sit for the National Counselor's Examination, not the clinical part, but just the the didactic, the information part, just to see if I know what I'm talking about. And if I take that and I have this limited license, which I really want to get that limited license ASAP, Jeremy, and that means that like I can stretch my wings a bit more. And so, like, if I can't, like, you're going to be staving off the tide of no, don't take your exam just yet. Like, I mean, how is that going to play out with practitioners who are hiring these folks and then trying to keep them unlicensed for a bit? It's
right. Yeah. I mean, they're in a weird spot because it's like you do want to get that limited license as soon as possible.
Yeah.
And I think it's, private practice owners are going to have to make this decision right on their own to decide, which direction we want to take. And then those people also have to decide, where do you get a job after? And I think there are plenty of jobs out there to pursue. And mental health providers are not going away anytime soon. And I think you see this too with just all the changes. So, yeah, we'll see. I mean, I think if you're a pre-licensed person or a limited licensed person, it's really a numbers game. Interview with whoever you can. And if you're a private practice owner, making the best strategic decision you can given the current situation.
Do you know if that's because you mentioned somebody in Michigan with that issue? Are you seeing that same issue playing out with your clients across the country? Like they're having to hire pre-licensed?
Totally. Yeah, we're seeing that trend carry forward pretty much across the board. And a lot of that has to do with uncertainty, right? We're a week away from the election, right? And that's a big deal, right? With some private practice owners because they don't know where healthcare is going to go and where taxes are going to go and that kind of thing. So it really does impact people in a big way. So yeah, it's an interesting time. It's fascinating to see how this stuff plays out. And we'll see what the conclusion looks like.
Yes. I think there is a Chinese curse or saying, if you will, may you live in interesting times. We're living that way, I suppose, these days. But thank you, Jeremy. Do you have anything else you'd like to add? This is super informative, hopefully informative for practitioners or people who just like to look at these kind of global trends. Economists might enjoy this episode. People from McKinsey might enjoy, or Accenture might enjoy you hearing it. Or the person down the road who's going to make me do Likert scales up the wazoo in a couple of years. Yeah. Blueprint Health. This is really intriguing stuff, and I know it's going to help me, and I'm sure a lot of other people out there. Not just in the long run, not just the practitioners, but the consumers as well. Keep an eye on this.
That's great. Well, thanks for having me on, and thanks for seeing clients. I know it's been a tough year for everybody, but for all the clinicians listening, you've done a great job hanging in there.
Well, thanks so much. We appreciate that. And just another maybe not so soft plug, Practice Solutions. Practice Solutions. If you're looking for a great biller, Jeremy and company are there to help you out.
Yeah, we'd love to work with you. Our mission is to make sure that you can focus on patient care without having to worry about your billing. So we want to see that at large, for sure.
Absolutely, yes. Excellent. Okay. Well, thank you so much, Jeremy. And we'll hopefully talk to you soon, maybe after the election.
Yes, sir. Great. Yeah, sounds good. Thanks, Scott.
All right, thank you. Well, I hope you enjoyed my interview with Jeremy. If you would like to reach out to him and his team, they can be reached on the web at www.practicesol.com. That's practicesol.com. The situation we find ourselves in with the current pandemic and the switch to remote work has upended much in our world, including the delivery of psychotherapy. As I'm recording this, the election is over and a new administration will take to the White House. The Supreme Court's opening remarks regarding the fate of the Affordable Care Act have been interpreted as hopeful for the public market to remain available as an option for insurance. But as we are still in interesting times, we have yet to see where everything that is in play will lead us, hopefully to a brighter future. Thank you for listening. Thank you for listening. Please take a moment to subscribe to us at Spreaker, Apple Podcasts, or whichever streaming service you use. All material is copyright the Psychology Talk podcast. This show is for entertainment and informative purposes only. If you need a mental health professional, please seek one out. Music is provided by the band Serenati.